So my name is Tom Rourke, and my position is consultant ENT surgeon at the Royal Berkshire Hospital, but also at the ENT consultancy in Reading. Yeah, I mean, it goes back many years. My grandfather was a GP. My parents were both dentists, so I guess I had a bit of a medical sort of slant in my childhood. And I had sort of a lot of my parents' friends were sort of doctors, and I guess quite a few of them were surgeons. So saw that kind of career path and quite liked it. So I actually decided from a very young age, probably a bit unusually, from about the age of 10 or 11, that I wanted to be a doctor. I've actually got one of my school yearbooks said that I wanted to be a bone doctor when I was 10 years old. I didn't actually end up being a bone doctor, obviously. That probably would have been an orthopedic surgeon. So knew from quite an early age that's what I wanted to do, and then worked hard towards that. It was sort of obviously about choosing GCSEs and A levels that fit with that sort of career path. And then yeah, haven't really looked back since, really. So it was from a young age. Yeah, I mean, I think for me, when I came into medical school, I was fairly confident I wanted to be a surgeon. So I knew that probably medical practice, so being a physician in a hospital or a general practitioner, probably wasn't sort of suited to me, really. So I was quite a practical person, and enjoyed the concept of operating, and enjoyed the sort of dissectional stuff at university. So I was going to be a surgeon. I actually had my ambitions to be probably a general surgeon, so an abdominal surgeon. But during the first 3 years of my junior doctor training, so I'd qualified, I worked in a rotation of 3 or 4 different specialties, and one of those was ENT, and just really fell in love with the specialty really during that process. I kind of like the variation of it. I think there's certainly different types of aspects of operating, from the head and neck aspect, which is quite dissectional. There's the nasal stuff, which is endoscopic, and then there's the microscopic stuff with the ears. I'm predominantly a skin surgeon these days, so I do head and neck skin cancer surgery. That's my sort of kind of area of expertise, and that involves a degree of creativity and artistic flair, I guess, as well. And I also did an A level in art and sculpture, so that kind of tied in quite nicely. I think the other thing there's 2 other things about ENT that attract me. It's quite a medically heavy surgical specialty, so we proportionally operate on slightly less patients that we see in clinic compared to like orthopedic surgery or abdominal surgery or ophthalmology surgery. So there's an element of medicine in there as well as just surgery, if that makes sense. And then I think there's quite a varied patient sort of age range. You know, we see a lot of kids outside of pediatric surgery as a specialty. ENT see the highest proportion of children, and then we have quite an age range up into the elderly patients as well. So it's quite a broad spectrum of specialty that adds a lot of variability and interest, which I enjoyed. I think there's 2 sort of points to this, really. I think the first is the surgery. You know, I like operating. That's what I do. That's my kind of job at the end of the day, and I enjoy the challenges that come with that. I enjoy the sort of rewards that come with that. As I said, my expertise is predominantly in head and neck skin cancer. So the main aim of that is to remove the disease and make sure you've got it all out. And the secondary aim is to make it ideally look like you haven't been there, and certainly look like it's been, you know, the scars heal well and in the right positions. So that I find, you know, really enjoyable, and I get a huge amount of satisfaction from that process. I think the other thing is you know, making people better, which is probably a bit of a cliche, but you do see people sometimes at their worst when they are really struggling with a disease or with a medical condition, and you know, you're in a position to help them, to walk them through that process. Sometimes involves an operation, as in I said before, in ENT, sometimes not. It will be a medical treatment or just a diagnosis and reassurance that there's nothing significant going on, which is quite a common sort of situation we often find ourselves in. So that probably for me is the bigger reward, and the bigger sort of satisfaction I get is you know, again, to avoid the cliche, it's helping people and getting them through that process really in smooth way as possible. I think hopefully the stage of my career on that, they probably would value my experience. So I've been a doctor for over 20 years. I've been a consultant for just under 10 years. So I've had, quite a lot of experience in both treating people, diagnostics, investigations, and then ultimately, obviously, the surgical expertise around that. So I think they probably would recognise that I'm getting to the point where I've got a lot of experience, and therefore that's quite valuable to the patients. I think I'm hopefully would regard myself as a reasonably good communicator. I can listen. I'm quite honest. I'm quite direct, and I won't shirk around diagnoses and say things that people don't want to hear. I'm a believer that you should really be upfront about what you think is happening to the patient, give them the options on board, and then discuss those through with the pros and cons of each, and then reach a decision together. And I think that's probably what they would value from me as well. I think what hopefully I value from patients is the satisfaction they give me. And again, it's a bit of an old cliche, but they allow me to do my job, and allow me to get the satisfaction out of that gives me, the rewarding career that I've had to date. I don't sort of necessarily have any direct mantra that I apply on a daily basis. I think specific to skin cancer surgery, sometimes I would say that more is less, which is a sort of a rotation of the normal phrase, in that sometimes making slightly bigger scars and incisions in the right places will end up looking cosmetically better, and doing the right operation, and that sometimes might involve a slightly bigger operation, will give a better outcome cosmetically to the patient. So that's a sort of surgical catchphrase that I probably have, that I teach to my trainees. In terms of sort of medicine in general, I think it's just honesty and talking through conditions, and communication is key, really. That is, I think, for me, alongside being organised, the crux of being a good doctor is being able to listen to people, to understand what their main issues are, and then to be able to respond to those and offer either reassurance or appropriate diagnosis and treatment following from that.